Hi guys, it's been quite some time since I made my last treatment video. This video is going to be about acne scars. Now, acne scar treatment is one of the most commonly done treatments in a dermatology clinic. Lot of patients come for it, but some of these patients get good result, some of them get average result. It is one of those treatments where a patient might not get 100% result. But in this video, I'm going to tell you how we can get closer to that 100% improvement in acne scars. So in our clinic, we follow these 3 steps for most of our acne scar patients. We found if we follow this, we can get up to 70 to 80% improvement in acne scars in most cases. So the first step for any acne scar treatment is subcision. This is especially important if your acne scars are moderate to severe. What does subcision do? In subcision, we make a small entry point right here near the side locks, and then we put a subcision cannula in the deep dermis. Now we use that subcision cannula to break the fibrous bands. These are the bands that are formed when the acne healed, and these are the bands that are tethering the acne scar down. Due to the destruction of these fibrous bands, there is a formation of hematoma. There is recruitment of lot of inflammatory cells, and when inflammatory cells come, then the collagen production starts to form. In most cases, subcision is not done in every session. Mostly, even if we do one time, the fibrous bands are broken and the scars lift up. And in the subsequent sittings, we can do the step number 2 and step number 3. Now, is subcision painful? Well, it looks to be a little painful in the videos, but before putting in the cannula, we give a small bolus of anesthesia, and then we put the cannula. The cannula generally moves in the deep dermis or the fat layer. This layer has lot of space in it, so it is only mildly painful for the patient. Remember, subcision is very important in case of severe scarring. Now let's move on to step number 2. In step 2, we use a energy based device that penetrates deep into the skin, releases radio frequency and breaks the fibrous band. The gold standard for this treatment is Morpheus 8, also sometimes called Morpheus Infinity. Morpheus is basically an advanced microneedling radio frequency device. Why do we call it advanced? Because unlike other microneedling radio frequency devices, it can penetrate deeper, and it is one device that can give continuous bursts of radio frequency energy in the collagen. I have personally used some MNRF devices before, but in my personal opinion, Morpheus is more consistent and also delivers stronger radio frequencies than most of the devices. Since we have used this particular radio frequency device, our results for acne scarring have definitely been better. Now let me take you through the process. So in the first step, we put the numbing cream on patient's face. Now this makes the superficial skin of the patient numb, and then we do subcision if required. Otherwise, we move to the step 2, that is the Morpheus. This is a Morpheus machine and it has a cartridge in front. We set the energy and we set the depth of the machine. The depth can be 1 mm, 2 mm, 3 mm, 4 mm on the face. On the body, this can go up to 7 mm. Then we choose the energy. In most cases, it could start from 8 millijoules and we take it up to 12, 15 or even 16 millijoules. In the first session, we keep the energy a little low and we do 2 to 3 passes on the whole face. We do these passes on different depths, 1 mm, 2 mm or 3 mm. In some cases where there's lot of fat, we might go up till 4 mm. The energy delivered from the Morpheus device breaks the collagen band, and once these collagen bands are broken, the skin slightly rises up and the scars appear less. But this is not it. In the next 2 to 3 days, there is healing in the patient's face and gradually the skin becomes normal. Even after 6 to 9 months of healing, there is formation of new collagen, and this makes the skin firmer and further improves the acne scars. Now let's talk about why, in my personal opinion, Morpheus 8 outperforms other acne scar treatment. First is the depth, so it can go 4 mm deep and deliver radio frequency, that too continuously. This helps us target the deeper scars better. Second is more collagen production. Unlike other microneedling devices that do not have energy or low amount of radio frequency, the device has a lot of potential to increase the radio frequency energy, and this gives better result. Unlike the other treatments like the carbon dioxide laser, Morpheus has lesser downtime. Even if we do an aggressive treatment, the patient mostly heals in 5 to 6 days. Because Morpheus 8 is fractionated, so there's lesser chance of hyperpigmentation compared to traditional lasers. And finally, Morpheus will not only improve your acne scars, but it works at a deeper level. So if you have extra fat in your face, if you have wrinkles, or even if you have general dullness, Morpheus can help you improve all of these. Now let's go to the third step. Well, this is a step which in my opinion is very important and very few doctors are actually doing this. So when we do subcision and Morpheus, now your skin has moved away from the fat layer because the fibrous bands have broken. But if we stop the treatment right there, the tendency of the skin is to contract back because it has been in that scar position for so many years. So what we need to do here is put something between the skin and the deep dermis so that the skin does not go back to its original place. For this, in my opinion, the best solution to use is a skin booster. Now the skin boosters of various brands available. You can discuss with your dermatologist and choose a preferred brand. I personally prefer skin boosters that are a bit hard and that last a little bit long. In my practice, I've used Galderma's Vital. I put this in the subcision plane. It spreads out pretty nicely. The patient might feel a little bit bumps 2 or 3 days post doing this, but once the patient massages at home, the hyaluronic acid spreads pretty well. This gives 2 advantages. One is the skin does not contract back, and the second, the skin booster also increases the collagen production. So a combination of subcision, Morpheus and skin booster. Just imagine how much collagen production we have created. If you are on a budget and you don't want to use skin boosters, you can also use PRP or PRF. So if you struggle from acne scars and you have taken treatment before, or you haven't taken treatment and you want to start your treatment, do talk to your dermatologist about combining these treatments. I think these treatments have worked very well for my patients, and I hope that these are useful to you as well. If you have any doubt, any query about acne scar, or you want some guidance on acne scar, you can put your questions in the comment section below. We will try to answer your queries. If this video was useful for you, please subscribe to our channel. Share this video with anybody you know have acne scar and is considering treatment for it. This will help them a lot. I'll see you in the next YouTube video. Till then, goodbye.